Hello, welcome to today's webinar, Coronavirus Estate Managers Need to Know, which will be presented by the National Apartment Association and the Institute of Real Estate Management. The webinar will be moderated by Stephanie Anderson. We would like to call to your attention the webinar disclaimer that is on your screen now. Now I'd like to introduce today's moderator. Stephanie Anderson is the Manager of Industry Operations for the National Apartment Association with 15 years of property management experience. She holds a Virginia real estate license and is certified as a national instructor for NAAEI. Stephanie, welcome to the program. The audience is all yours.
Thank you for the introduction, Julie. It's my pleasure to introduce today's presenters. Steve Core is the president of River Rock Real Estate Group with over 26 years of experience in property and facility management. He has overseen management operations for a 7 million square foot portfolio of office, industrial, and retail properties in Southern California. Steve holds the CPM designation from IREM and also holds a California real estate license while serving on the BOMA Orange County Advisory Board. Also joining us today is Cindy Clare. Cindy is a certified property manager and the chief operating officer at Bell Partners, overseeing the operation of over 60,000 apartment homes and more than 159 apartment communities across the nation. She is recognized leader within the multifamily industry and has served as chairman of the National Apartment Association, president of the Apartment and Office Building Association of Metropolitan Washington, and served as a regional vice president for the Institute of Real Estate Management. Welcome, Steve and Cindy. For today's agenda, we'll begin with an overview of the outbreak and finished with a Q&A with our experts, Cindy and Steve. Coronaviruses are a large family of viruses known to cause respiratory infections ranging from the common cold to more severe diseases. The most recently discovered coronavirus causes disease COVID-19. Some common symptoms include fever, tiredness, and dry cough. Symptoms are usually mild, while some will not develop any symptoms at all. Roughly 80% will recover from the disease without needing special treatment. Around 1 out of 6 people who get COVID-19 will become seriously ill and develop difficulty breathing. Older persons and those with underlying medical problems like high blood pressure, heart problems, or diabetes are more likely to develop serious illnesses. COVID-19 is spread through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. Touching objects or surfaces with these droplets and then touching one's eyes, nose, or mouth, and also by breathing in droplets from a person with the virus who coughs out or exhales droplets. Most importantly, how can we protect ourselves? Regularly and thoroughly washing our hands, maintaining at least 3 feet from anyone coughing or sneezing, avoiding touching eyes, nose, and mouth, follow good respiratory hygiene, stay home if you are sick, and stay informed on the latest developments in COVID-19 geographic hotspots. And now for our main event. For our first question to Steve and Cindy, what should I do to prepare my employees, residents, and tenants for the coronavirus?
Steve, do you want to start, or would you like me to start?
I think it's all yours, Cindy.
Okay, it sounds like it. So one of the things that we've done at Bell to prepare both our residents and our employees about the coronavirus is just sending out a reminder notice about the things that Stephanie just outlined. That there is a disease, that it is spreading rapidly, and the preventive measures that can be taken. We have also added the CDC website to those communications to let people know that they can go there to get information about the virus. And then what we've also said in the emails or letters is that we are monitoring the situation. We'll update them with additional communication as needed.
Great advice. Steve, did you have anything to add?
Yeah, like Cindy, we've depended on information from the CDC and the WHO as well. We prepared tenant and internal e-blasts. We've looked at this on a 3-phase approach to educate, equip, and support. So we've forwarded off the education information. we've equipped the offices and the buildings with hand sanitizer, cleaning supplies. We've increased our frequency. We've talked to all of our large service providers and increased the scope of cleaning throughout all the buildings that we're managing right now. So we're doing everything we can possibly do while continuing to monitor and, again, educate everybody as we have shifts and progress in the situation.
And I would agree. We've added the hand sanitizer in our amenity spaces. We're trying to put disinfectant wipes. And I say trying because as you guys all know, as you start looking for the disinfectants, the disinfectant wipes and the hand sanitizer, they're getting harder and harder to find. But anything that we can do with extra cleaning as well, I think all of that makes good sense.
That's great tips. I agree. Hand sanitizer is a little bit difficult to find these days, but I think it's great that you're finding the resources that you need to make available to your employees and residents. So now that we know how to prepare, let's talk about, should we create a pandemic plan for your management companies or even for your properties? And if so, can you walk me through what are those key elements we should be including in the plan?
I'm happy to share River Rocks. We've done both for both work and the properties. From a work standpoint, we absolutely thought it was necessary to create a plan early on. So we've revised a few things. We've revised our work remote, work from home plan to where anyone's exposed, infected, or their family members are exposed or infected. We're requiring everybody to work remotely. We've actually revised our sick policy as well. So there's no longer any punitive sick time here. If you're sick with the coronavirus, we're encouraging you, requiring you to stay home, and we'll pay you to stay home and work. We've already aligned with our IT provider to provide everybody access. For those that don't have computers or the necessary equipment at home, we'll be supplying that to them so they can continue on with their job. We've also looked at flex time. So especially up in Northern California, where we rely heavily on public transportation for our employees, we've shifted schedules to allow them to travel during non-peak times. And actually for the next 30 days, we're actually paying for Uber, Lyft, non-public transportation for people to come to and from work. And, during the work function, we'll take care of that, absorb that cost for them. On the property level, we continue to educate, again, provide the hand sanitizers, and really providing timely notice if there is an infection or there's an exposure. We're letting the tenants know so they can determine how they best want to approach the situation and deal with their occupancy.
And so to add to that, we've done the same thing. We have a plan that we're using for both our corporate offices and regional offices across the country, as well as for our properties. And in many ways similar to what Steve's talking about, we've identified that if there is an associate at a property, for example, that is found to have the virus, that we would close that office for a day, do a deep clean, quarantine the staff that was exposed, and staff that property with other people. So we've taken it a step further, not just to look at, right now we're very fortunate we haven't had to use it, but we want to be prepared in case we do have an associate in any of our offices. And we would use that same protocol in one of our regional offices or corporate office in Greensboro. So we've put that into place. We've also, again, given them the steps to advise, to make sure they advise someone if they are diagnosed with COVID-19, and the steps that we would take. We're also asking our residents that if they're not comfortable coming into the office, we're promoting their, online applications, online leasing, online payments, online maintenance requests, so that our residents are comfortable but know that we can service them as they need, as they are comfortable. In addition, we're requiring all staff to take their laptops home every night so that they can work remotely. And our IT department has ensured that that everything can be done remotely through our cloud system. So again, very similar to what Steve is doing.
That's great. Both Cindy and Steve, you both mentioned, opportunities to work from home and acknowledging the sick time policies. Should we encourage members to update their HR policies, given the recent events?
I don't know that you have to, it depends on what your HR policies said. Our HR policies provide for sick leave and then also provide for short-term disability, so that if indeed somebody were, diagnosed and had to stay home for 14 days, that they would be covered. But I do think, if you're particularly asking people to be quarantined, then you probably do, and you don't have cover enough of their sick leave, then I think you do have to look at that as one of your HR policies.
I would agree with Cindy as well. I think it's up to every company to determine how they can best function and how they can support their teams. We just felt that, again, for us, it was better to have them home. Under this particular issue, they can still work, or the majority of them can still work. So we'd rather have them productive at home, taking care of themselves and taking care of their family. So again, we leave it up to each individual company. For us, we felt it was best to revise the sick policy as well as limit travel, limit unnecessary large gatherings and meetings, et cetera. So we put all that into play.
And we have not limited our travel at this point. We're watching that. Our feeling is we need our teams out at our properties. However, we have also suggested to people, if they're not comfortable, for example, flying, that we'll offer alternative arrangements for them to drive or do something like that. So again, I think each company, as Steve says, has to figure out what works best for them and how to manage this. And I don't think that there's one answer. I think there are multiple answers, and the company has to get comfortable with what works best for them.
So as we acknowledge here that, this is evolving every single day. We're receiving new information from the CDC each day about this. And of course, there's an unknown time frame for how long, this will continue to go on. Should we have a business continuity plan in place?
I think you should always have a business continuity plan in place. We're always talking about, different issues that could impact us and interrupt business. I mean, like Cindy, we're a service industry. We have to be here to service our customers and our clients. This is a little unusual. This is something that we generally don't have to prepare for, and I don't think most companies are ready for massive absenteeism or lack of manpower and how to cover for it. But I think everyone needs to examine it. It's hard to gauge, I think, particularly in this situation, what we're going to need 30 days from now. It may not be significant. It could be, devastating. We don't really know. But we have checked and put in place some backup systems. We've started cross-training critical functions with staff. Again, we've already talked about what we've done with IT and cloud support and equipment, et cetera. So we've put all that into motion. And I think, if you haven't done it already, you're already behind the time.
And I agree with Steve. I mean, we already have a business continuity plan. However, we are revisiting that plan. To Steve's point, you don't expect, you're really thinking about fire, flood, hurricanes, the natural disasters, terrorism at this point. But to have to deal with an infectious disease, we did pull out our business continuity plan. We have made adjustments. We are looking at that. And, to Steve's point, we've looked at, okay, how much can we get done remotely if we need to? And then what are those things that we can't do remotely, and what are we going to be able to, how are we going to arrange that so that we don't have any interruption in our business? And I think that, as Steve said, if you don't have that in place already, regardless of whether you had the COVID-19, you really do need to think about a business continuity plan.
So as we think about running our business, are there any lease clauses that should be reviewed to address potential tenant business disruption?
From a multifamily, go ahead, Steve.
Oh, sorry. On the commercial side, the leases are fairly silent when it comes to issues like this. The one section of the lease that we can all review and we are looking at is the business interruption coverage in the insurance side. But as far as other clauses go, it really, again, the commercial leases are silent and they don't take something like this into account.
And clearly on the multifamily side, there's not anything in the lease. I think where you would end up with potential risk, and I was just talking to someone about this today, is if you choose to close your amenity spaces because of the risk. So let's say you close your fitness center or you don't allow the common areas or the amenity spaces to be used. you could have a resident that says, well, I want a rent credit because I can't use all of the services in my property. So I think you have to be prepared to understand the implications of decisions you make, but there's nothing specifically in the lease, in a multifamily lease, that would address this. And again, it's because these are people's homes, you're not disrupting their business. It's really the level of service that you're talking about. And if you do decide to reduce your level of service out of an abundance of caution, I think that's where you could end up with an issue on your leases.
I would agree. Now, many of you have talked about communication as it pertains to our employees, residents, and tenants. So what type of information can we provide to residents and tenants in regards to hygiene protocol and hopefully preventing the spread of infection?
So we provided, as I said at the opening, and I think Steve said the same thing, we basically have given people the list of items that are recommended by the CDC with regard to hand washing, covering your mouth, all of the things that they've listed. We've literally taken those off of the CDC sites and put those into the notifications. In addition, we've done flyers that we're posting in our leasing offices and in our corporate offices with those same CDC recommendations for preventive measures. And then finally, we had given out the CDC website to talk about it. So I think the more we can remind people of the preventive measures, the better off we're going to be. We can't diagnose for people. We can't tell people what to do, but we can certainly give them reminders and educate them. And I think that's exactly what Steve said at the beginning of this.
I can't add much to that. I agree with Cindy completely. We continue to educate. We rely heavily on the CDC and the World Health Organization. We've actually been requested to start monitoring temperatures in some of our buildings and screening people as they enter the building. And we remind people that's not our business. That is way out of our area of expertise. And that's something we just won't do. So we're going to continue the campaign of educating. We'll continue to send out email blasts to the tenants, updating them, reminding them, and of course, encouraging them if they have any concerns to seek medical advice as soon as possible.
So even using these preventative measures, worst case scenario, one of our tenants or residents has a suspected or even a confirmed case of the virus. What should we do?
Well, I can tell you we've already crossed that bridge. We've just in the last 5 days, we've had one single tenant occupied office building closure, and we've now been informed of a tenant that potentially has been hospitalized with the virus. And what we've done is we've put our plan into action, and we've notified the buildings. We've notified the buildings that there's been a potential exposure. Again, privacy laws prohibit us from getting into any detail. Although we've been probed for more detail, we won't disclose, but we'll notify them. We'll take the necessary steps in notifying all of our vendors, our clients, anybody else that works in the building. And then, of course, we'll contract for cleaning. Again, that's all we can really do as the landlord, is to take the steps to make sure that everybody's notified of a potential risk.
And I would agree with that. I think it's a little harder on a multifamily building because we may not be notified by our residents. It's a little different in an office building. But if we are, we can't, the only thing we can do is let people know there's a potential, person in the building. We can't give information. There are privacy laws. We would have to make sure that whatever information we give, we are not violating someone's privacy, because particularly in the multifamily, it's a little more heavily regulated. So we've also said we would go through any of that with our legal counsel just to be safe and ensure that we are not only, protecting people, but also protecting the privacy of the person that may be infected. I think that it's, again, we're more likely to learn about it from the media than we are from the resident living on the property. And so I think that you also need to be prepared for that kind of information coming out through the public versus just coming through your property level.
Okay, so I have to ask, I'm getting so many questions from so many people, but I will tell you the number one question I'm getting lately is, should we eliminate handshaking? What are your thoughts on that?
I've seen everything on the internet, from elbow bumping to knocking knocking ankles instead of handshaking. Personally, I just think we need to exercise some common sense. We have not prohibited or eliminated handshaking. I can tell you, we're all washing our hands a lot more frequently. We're using the sanitizers more frequently, but we're still shaking hands at this point.
Like Steve, I've seen all of it, and I do know that there are companies that are eliminating handshaking. We have not eliminated it at this point. However, we've told people, as Steve said, to use common sense. And if somebody's uncomfortable, we're not going to force them to shake our hand. But I think it goes back to, again, those preventive measures, making sure you are washing your hands, that you're using the hand sanitizers, that you're doing those things that are going to help you, prevent the disease. I would say right now that we are not doing any of that, but it doesn't mean that a week or 2 weeks from now we may not change that stance, depending, as Steve said at the beginning of this is something that is ever changing and evolving, and we have to be nimble enough to make those changes as we see what happens. But for right now, we are not eliminating handshaking.
That's great feedback. Thank you. So let's talk for a second about, implementing any sort of mandatory work from home periods for employees who travel. And this can be about even employees that travel just across the states here. Are you doing anything within your organizations about this?
So this is a tough one. And I would tell you that we are not doing any mandatory work from home, nor have we eliminated travel at this point. One of the challenges I think you face when you go to the mandatory work from home, unless obviously you're quarantining somebody, but if you're just asking people to work from home, that does not mean that they aren't going to go to the grocery store, go to their children's basketball games, go to a school, and still be in touch with large numbers of people. So again, at this point, we are not eliminating travel, but we are monitoring it carefully. And we are suggesting, obviously, if there's a large outbreak, that those are areas we should, unless it's necessary, go to. But again, I have properties to run and residents that are expecting service, regardless of where those properties are. And so we have to provide that service. So it goes back to the preventive measures, making sure you're being careful and taking the appropriate steps. But we still have to run our business at this point because, as Steve said earlier, we're in the service industry.
We absolutely are. So
I was going to say, Steve may have a different viewpoint here.
No, I was going to say I completely agree. We have eliminated unnecessary travel. It certainly doesn't mean to our properties. We're still providing service there. Work at home has always been a struggle issue, period, regardless of the current situation. We're not mandating people work from home unless, again, they're exposed or they've been confirmed to have the virus. We are encouraging people to consider their vacation plans. If we have a lot of people like to travel, outside the United States, and we've asked them to just take into consideration. And if somebody does travel to an impacted area, we will most likely require them to work from home for 14 days upon return and monitor that. And again, that's as of today. I mean, this could all be different 2 weeks from now.
Right. We may have mandatory work from home in 2 weeks. And, and again, I think we've had those same conversations about people that are traveling out of the country. We're not doing any, from a business standpoint, doing any global traveling at this point.
So you just mentioned how things could change in the coming weeks. So with that being said, what resources and agencies should our members be referencing for the latest information?
I think, like we've already discussed, the CDC and the WHO are the go-tos. We're not in that, we don't swim at that end of the pool. So we rely on the experts, and we're going to continue to help educate and relay information that's provided by those organizations. They can also keep in touch and check in with organizations such as IRM and BOMA that are doing a lot of posting right now.
And NAA and NMHC. So yeah, I agree. It's the CDC, it's WHO, and then it is the trade organizations. So BOMA, IRM, NAA, NMHC. All of them have been providing good information, much of which they're getting from the CDC as well. But I think looking at all of those resources so that you have as much information as you can before you make those decisions is really important.
Well, Cindy and Steve, thank you so much for your time today. We've had amazing jam-packed 30 minutes of conversation here. On your screen is some additional resources like were mentioned earlier with WHO and CDC, where you can find up-to-date information. In addition, we encourage you to go to NAA and IRM's websites, where you can find additional information that's ever-changing. Julie, did you have anything to add?
No, I'd just like to thank everyone for joining us today, and check back on our website soon. We will be updating the fact sheet with the questions and answer session. If you have any other questions, feel free to contact us.
Thank you so much, everyone.
Thank y'all.
Thank you.